Now to the latest on Ebola. The Centers for Disease Control now plans to send rapid response teams to any hospital in the country that deals with an Ebola diagnosis. Dana Tyler in our newsroom now with more for us. Dana.
Maurice, the move comes as nurse Nina Pham remains in clinically stable condition at a Texas hospital. She became infected while tending to the first Ebola patient diagnosed in the United States. Today, the CDC director is saying it's still not clear how the nurse became infected, but wonders if those rapid response teams could have prevented it. Nina Pham, the Dallas nurse battling the Ebola virus, said in a statement, quote, "I'm doing well and want to thank everyone for their kind wishes and prayers." The 26-year-old who contracted the virus from patient Thomas Duncan remains in isolation at a Texas hospital, along with another man with whom she had contact. Pham has received a blood transfusion from Kent Brantley, a Texas doctor who's beaten the Ebola virus. Brantley said in a recent speech he offered his antibodies to Duncan, a Liberian man who died last week at the hospital, but their blood types did not match. The 911 call was released today from the daughter of Duncan's girlfriend.
My daddy is showing up. He got a fever.
I got the ambulance on the way.
The Centers for Disease Control Director Dr. Thomas Frieden says the 48 people who Duncan came in contact with before his hospitalization have gone through 14 of the 21 days of risk without illness.
While it wouldn't be impossible that some of them would develop the disease, they've now passed through the highest risk period.
76 others who might have had exposure to Duncan at the hospital are being monitored for symptoms. The CDC believes there was a breach of protocol and that nurse Nina Pham may have caught the virus from Duncan due to the way she removed her protective gear. Frieden says Pham has been helpful in trying to determine the cause of her contraction.
A single infection in a healthcare worker is unacceptable. And what we're doing at this point is looking at everything we can do to minimize that risk so those who are caring for her do that safely and effectively.
The World Health Organization said today there could be as many as 10,000 new Ebola cases per week by the end of November. Maurice?
All right, Dana, thanks so much. So is New Jersey prepared for an actual Ebola outbreak? The state health commissioner wants hospitals put to the test, so the answer is yes. She is calling for fake patients to be sent to hospitals to test their readiness. The drills are designed to make sure staff identify potential Ebola patients, handle them according to protocol, and that everyone can correctly put on and remove protective gear.
And donations are pouring in to help stop the epidemic. Today, Facebook founder Mark Zuckerberg announced plans to donate $25 million. The money will go to the CDC Foundation to fund training and assist first responders. Now, the Bill and Melinda Gates Foundation last week pledged $50 million to support emergency response. That is on top of $10 million the foundation has already committed.